Hi, I'm Dr. Natalya Lopushnyan, and I'm a board-certified urologist with Greater Boston Urology. You know, it's really staggering, and it's a problem that men don't like talking about because they feel like, you know, it's not glamorous, and they feel like they lose their character and their masculinity. But truth is, there are so many men out there with erectile dysfunction issues, and you don't have to be completely impotent. I mean, erectile dysfunction is anything from not getting hard enough, not lasting long enough, and there are a lot of men out there with that. In order to have good erection, you need to have three things. You need to have a penis. You need to have good blood flow to your penis, because that's what erection is. It's increased blood flow to your penis. And you need to have good nerves that supply those blood vessels in your penile tissue. So anything that can affect your penis, your blood vessels in the penis, or the nerves that go there can cause erectile dysfunction. The most common causes are usually vascular disease, heart disease, high blood pressure, or diabetes. Generally, we want to start with evaluation of the patient. You know, I personally don't like just throwing medications at the patient because you really want to know what the cause is. But in the garden variety ED, you know, mild to moderate, we will try the medications first. And what those medications do, they really improve blood flow to your penis to really improve the erection. It really depends on the patient and what their goal is and what their lifestyle is and what they want to get out of it. Once the medications don't work, we can offer a couple of different things. So for example, we can always try injections, and that's a treatment where a man would actually inject a tiny bit of a medication into their penis. And anytime I say inject something into your penis, everyone cringes and rolls their eyes and says, "You're crazy, what are you talking about? I'm not stabbing myself, especially down there." But trust me, I teach men how to do that in my office, and probably out of 100 men, maybe 1 or 2 will say, "Wow, that was really uncomfortable, I'm not going to do that," because it sounds a lot worse than it actually is. And it works really well for most men. Other options are things like vacuum devices to bring blood into the penis just by the vacuum suction, and things like intraurethral suppository, where you put a little pellet of the medication actually inside your penis. Those are the non-invasive, non-surgical treatments. If we go further to men with complete impotence or really poor blood flow to the penis, you know, we can always talk about penile prosthesis, which is actually an excellent and very, very reliable option for treatment of the ED. Talking about ED is not glamorous, you know. People don't want to talk about erections unless they have amazing erections. So what I do in my office, even when I'm seeing a patient who is not there to talk about erections, but say they're there because of their prostate issues, urination, kidney stones, etc., but they fall in that age range, maybe like early 40s or older, I actually ask them myself, "Hey, how are your erections?" And if they say, "You know, I'm totally fine, not a big deal," that's great. But probably about 70 to 80% of men who did not bring it up initially will share that, yeah, you know, like it's not working as well as it used to, or it's not working at all, or "I'm so glad you asked because I did not know how to bring it up." The major improvement is in their self-esteem and their relationship with their significant others. And once you get them past that barrier, you show them you can have erections, their personal life just improves so dramatically. If you have a problem, come see us at Greater Boston Urology. We're always happy to see you.